think one thing to think about when you're thinking about eye surgery would be what are the risks of surgery? And so each patient, their eye is unique, and the risk that you might have for your eye may be slightly different than someone else. But in general, with cataract surgery or refractive lens exchange, we're going to remove the natural lens from your eye and replace it with an artificial lens. And so as we think through that process, part of that is going to be entering the eye through your cornea. So there's a little bit of extra fluid that we have to place in your cornea at the end of surgery to allow that wound to seal. That can lead to some blurriness in your vision that's fairly transient. It's usually gone within a few days, maybe a week. Some patients have a little trouble recovering with that part of it, and they may need a little extra treatment. But most everyone is going to heal very quickly within a few days after cataract surgery. Once we get into the eye, we have to remove that natural lens. Well, the natural lens is supported with zonules, and these are little collagen strands that help hold our natural lens in place. Some patients have weak zonules. Some patients have had trauma to their eye or damaged zonules. So each person, again, could be unique with what they need, but we have ways of bolstering those zonules and making sure that the little capsular support for your new lens is adequate. If not, we have techniques to secure the lens to the inside of the eye and still allow you to have great vision, but it may not involve us placing the lens in the capsule. The other risks of surgery are things like infection. You don't want to get an infection in your eye after cataract surgery, so we have a great list of sort of activities that we want to kind of hold back from for a little while, such as bending over, lifting heavy objects, rubbing your eye. We'll go through that in detail with you once we move forward with surgery. But the point is you don't want to get something from the external environment placed into your eyeball, and bacteria is a big concern. And to that effort, we use antibiotics during your cataract surgery, and then we also have you place them in your eye at home. Inflammation is a complication of cataract surgery. Inflammation pretty much happens for all of us just because we are breaking apart the natural lens protein. And that lens protein, as it moves around inside the eye, we do get some triggered inflammatory reaction. And therefore, we use a steroid and a non-steroidal anti-inflammatory eye drop that can be placed in the eye 3 times a day after cataract surgery. Most patients don't have a tremendous amount of inflammation, but every so often someone may need a little extra level of care. Other risks with cataract surgery could involve risk to your retina. It's pretty rare. It's probably less than 1 in 100, but every so often someone can have some swelling of the retina if the inflammation moves too far back into the back of the eye, and that might require an extra consultation and treatment with a retina specialist. It's been reported that retinal tear or detachment are a known complication developed for eyes that have had cataract surgery. Again, those are extremely rare and those are treatable, and we would make sure that if you're having any of those types of symptoms, we take care of making sure that you're getting the proper treatment. Sometimes the lens that goes in the eye isn't exactly staying where the surgeon would like it to be, or it's not delivering the type of vision the patient was anticipating. Very rarely, but also another risk of surgery could be that we need to do a second procedure. Sometimes we have to go back into the eye and remove that first lens that we implanted and place a second lens in that's a different style lens, or doing a different visual target, something like that. Very rare for us to need to move on to other treatments inside the eye after surgery. Sometimes a cataract can break off and escape from the surgeon's view and move into the deeper part of the eye. If that happens, your cataract surgeon most likely won't go chasing after that because that's considered high risk to do that when you don't have good visualization. So for your safety, what we do is we actually just stage the procedure. We remove the cataract that we have access to, we place the lens in the eye, and then we have you follow up with one of our retina colleagues who can safely, with good visibility and the proper microscope, get into the back part of the eye and remove the rest of the cataract. Should that happen, it doesn't affect your final outcome. It just creates an extra need for one more surgery. Other risks that could be related to cataract surgery may have something to do with the risks of anesthesia. That's why we want to always have a history and physical from your primary care doctor. Let us know what are your medical comorbidities and allow us to create a good anesthesia plan that's tailored to you. Some patients aren't great candidates for IV sedation, and so we just do topical cataract surgery, and they do wonderful with that approach as well. There are other issues that may come up with cataract surgery. Happy to discuss those further in detail with anyone who would like to have a consultation.